Continuing agglutination test. So I said that when precipitation is converted into, when soluble antigen converted into particulate antigen, so it becomes precipitation test becomes agglutination test. Some of the inert particles that are used are bentonite, latex, RBCs. So these are also called as latex agglutination test. Latex agglutination test. Example of latex agglutination test are C-reactive protein, C-reactive protein, rheumatoid arthritis factor, rheumatoid arthritis factor, and ASLO total, ASLO. These are all latex agglutination test. Example of latex agglutination test. So here soluble antigen is converted into particulate antigen. They are tagged onto the latex particle and do latex agglutination test. The example of latex agglutination test are C-reactive protein, rheumatoid arthritis factor, and antistreptolysin O. Antistreptolysin O. These are also called as passive agglutination test. These are also called as passive agglutination test. Instead of tagging antigen, if you tag antibody, onto latex particle to detect the antigen, it is called as reverse passive agglutination test. Passive agglutination, and this is reverse passive agglutination test. Reverse passive agglutination test. Reverse passive agglutination test. Okay. The very important agglutination test we do in day-to-day clinical practice is Coombs test. Coombs test is very important in feto-maternal compatibility. Feto-maternal compatibility. For example, if father is Rh positive, mother is Rh negative, first delivery will be uneventful. Nothing will happen to the first child. Nothing will happen to the uneventful. There will be normal child will be born in the first pregnancy. But during the first delivery, the RBCs of the fetus leak into the maternal circulation. during the first delivery, the RBCs of fetus leak into the maternal circulation. When second pregnancy occurs, if the fetus is again Rh positive, and these antibodies Rh antibodies come and attack fetal RBCs, giving rise to a condition called erythroblastosis fetalis. Erythroblastosis erythroblastosis fetalis. Now we have wonderful gadgets. We come to know that erythroblastosis fetalis happening in the mother's womb. That is, we have got a treatment for that also. What we do is we remove all the positive blood and exchange with the negative blood, Rh negative blood. We remove positive blood from the fetus and exchange with the negative blood. This is called as exchange transfusion. This is called exchange transfusion. This is what we are doing. Okay. This is called exchange transfusion. Other way to prevent is now actually please there is a lot of nowadays premarital counseling. Okay. You have to undergo all the tests. In fact, in one of the Goa and Maharashtra, all the um, brides went to the court. Marriageable girls went to the court that the boy should produce HIV negative certificate, vice versa. India is democratic countries that was turned down. So this blood grouping, and in so many communities there is something called matching of Kundli and Jataka and Gotra and so many things. If you are from same Jataka or why consanguineous, you should not marry a relative. You should not marry a very close relative, mama or very thin relatives. In Muslims they marry uncle's daughter. In Hindus they marry mother's brother's daughter. There in Muslim they are considered as doodh ka rishta. Here it is considered as blood relations. Khoon ka rishta. Doodh ka rishta versus khoon ka rishta. Okay. So before that, before marriage, you have to undergo blood grouping and RH typing. If you are compatible, you should not be RH positive and RH negative because these consequences. Because nowadays people are stopping at one child only. Getting one child and bringing up itself is very difficult. Now, what happens? We give vaccine here to formation of anti-RH antibodies. Anti-RH antibody. It's called as ROGAM. It is called as ROGAM, anti-RH antibodies. You did not answer me. The consanguineous marriage, why you should not get married to the close relative? Huh? What? Huh? So usually the genetic abnormalities are very common to get a consanguineous marriage. That's why you should marry not relative, distant relative. I mean, you should not be related to each other. That's fine. Okay. Of course, if you fall in love, nobody can prevent it. So, what is Coombs test? What is Coombs test? So, there is indirect Coombs test. There is indirect Coombs test and direct Coombs test. There is indirect Coombs test and direct Coombs test. There is an indirect Coombs test and a direct coombs test. Okay, now we'll start with indirect coombs test. You take washed you take washed O group RBCs. You take O group RBCs which do not have A and B antigen but O positive, RH positive RBCs. What do you take? O positive RBCs, RH positive RBCs. Add mother serum. Query, you do not know. Suspecting she has got anti-RH antibody. You add mother serum, question mark, anti-RH antibodies, question mark. You do not know whether she has got or she may not have. Okay. Then what happens? Although there is an antigen antibody reaction, it is not observable, it is not visible because these anti-RH antibodies are incapable of agglutination of O positive RBCs. They are incomplete antibody. Are you clear? Although there is an antigen antibody reaction, you cannot see because you will not be able to agglutinate RBCs because they are incomplete to cause agglutination. Then you add anti-human globulin, antibodies to human antibody. That is Coombs serum. Everybody say anti-human gamma globulin is a Coombs serum. Anti-human, everybody 10 times. Anti-human gamma globulin. Anti-human gamma globulin. Anti-human gamma globulin. Anti-human gamma globulin. It is called AHG. Anti-human gamma globulin. 10 times. Anti-human, everybody. Anti-human gamma globulin. Anti-human gamma globulin. Anti-human gamma globulin. Anti-human gamma globulin. Anti-human, then there will be agglutination. So we'll repeat once again. Take everybody take washed O group RBCs. Add mother serum. Although there is an antigen antibody reaction, you cannot observe the reaction because anti-RH antibodies are incomplete. They are incapable of agglutinating. Then add anti-human gamma globulin. Anti-human gamma globulin. Anti-human gamma globulin is also called as coombs serum. Anti-human gamma globulin is also called as coombs serum. Okay. So then you add, then there will be agglutination. This is called indirect Coombs test. Now, what is direct Coombs test? So imagine mother with Rh positive antibodies and fetus. Fetus with Rh positive blood cells. Okay. These antibodies have come and attacked this fetal RBCs. They have crossed the placental barrier. The sensitization has taken. The first step, what we told, is already taken place. So you take cord blood cell. What is that? Fetal cord blood cells. Cord blood, umbilical cord. Okay. Fetal cord blood cells. Add anti-human gamma globulin. Add anti-human gamma globulin. There will be agglutination. I repeat again. Okay. In fetus, already anti-Rh antibodies have come and attacked the RBCs, which are Rh positive. Although there is an antigen antibody reaction, first step is over, then you have to just add anti-human gamma globulin. There will be agglutination. This is called direct Coombs test. This you will not forget in your life. Okay. Yeah. Coombs test. Now moving on to the precipitation test. Precipitation test, it is a soluble antigen. Okay. Soluble antigen is used and precipitate is formed at the antigen antibody where they unite. At the site of union of antigen antibody, if you do in a liquid, there will be line of precipitation. There will be line of precipitation. There is line of precipitation. So one of the important precipitation tests is VDRL. VDRL is called as slide flocculation test. VDRL test is a slide flocculation test done for the diagnosis of sexually transmitted disease called syphilis. Done for the diagnosis of sexually transmitted disease, slide flocculation test done for the diagnosis of syphilis caused by treponema, done for the diagnosis of sexually transmitted disease called syphilis caused by treponema pallidum. So Here, little tricky, VDRL. Expansion of VDRL is venereal disease research laboratory test. Venereal disease research laboratory test. So, all the patient is suffering from Treponema pallidum, which is a curved organism. Tripos means curved, pallidum means stains pale. Stains pale. It gives rise to primary syphilitic ulcer on the male genitals called chancre. Hemophilus ducrei gives rise to soft sore that is called chancroid. Chancre and chancroid, multiple choice question. Chancre and chancroid, don't get confused. Chancroid, Hemophilus ducrei. How do you remember? I got a do cry. When you touch you should not touch with a bare hand, highly infective. When you touch the ulcer with wearing gloves, patient cries. Hemophilus do cry. Gives rise to chancroid. Chancroid. But it is painless, hard ulcer. Syphilis is a painless, hard ulcer called chancre. Chancre. Painless, hard ulcer. Patient will having antibodies against lipoidal extract of beef's heart. Very surprising. I mean, very. What is syphilis and what is beef's heart? You have to study zoology. What is beef's heart? What it contains. So lipoidal extract you take, that is called as cardiolipin. It is called cardiolipin. Cardiolipin. And lecithin and cholesterol. Lecithin and cholesterol are added to cardiolipin. And these lecithin and cholesterol are called flocculating agent. Lecithin and cholesterol are called flocculating agent. So if you are asked in the again, this is a MCQ which is asked in your PG entrance examination. So what is VDRL antigen? They will ask so many things, and one of them you should know it is a lipoidal extract. Everybody, cardiolipin is a patient suffering from syphilis develops antibodies against lipoidal extract of beef heart. Lecithin and cholesterol are added for flocculation. So there is a VDRL slide which is again given for your which is made up of cavities. Like glass slide it is, and add serum and antigen. Serum, and you rotate it, and there is a VDRL rotator that is 180 RPM per minute, 180 rotation. At the end of that, you look for the flocculated material in the low power microscope. Flocculation under LP, low power microscope. Once you have to do the dilution 1 in 2, 1 in 4, 1 in 8, 1 in 16, 1 in 32, 1 in 64, 1 in 128. Go on doing doubling dilution. Titer is defined as highest dilution of serum where you see the antigen antibody reaction in observable manner. Antigen antibody reaction seen in the case of observable manner. So the totally unrelated. Syphilis is the organism. Lipoidal extract from beef heart is uh, the syphilis antibodies react with the antigen which is extracted from the lipid mass. That's why it is a non-specific test. What it is called as non-specific test. But this is called as STS, standard test of syphilis. You do with complement using complement. It is called as complement fixation test using same antigen. It is called as Wassermann test. It is called as Wassermann test. If you do it in tube, it is called Hans test. It is called as Hans test. Wassermann test and Hans test. We'll continue this in the next class. Thank you very much. Write on the 3, 4, 7, 7, 4, 11, 11, 4, 15, 16 numbers. Only 16 numbers you write in. I'll tell you number of class you attend is equal to your proportion of marks in the practicals. Percentage of marks in your practicals. And internal assessment also, we see that if you have got 84% attendance in the class and practicals, we'll give 84% in your practicals. If you have got 60%, we'll give 60% in practical. Sometimes we may fail also if you are very irregular. This is all additional class is for your benefit only. I don't get any remuneration for conducting additional. That you should understand, and you should come taking little pain. What happens if you come half an hour early? Any problem with you? Last time you are not there. Why? Not well. Not well is always there. Everybody gives